everyone. Welcome to Aek Periuk with Dr. Mardiana and I. I hope this will be a happy Saturday morning for you. We will be covering a very special topic today, especially since this is like been there, done that for my boss, Dr. Mar. The hot topic now is COVID in pregnancy. Ayo, COVID in pregnancy and how it affects everything. This is something that we've been talking about a lot. Oops, ada orang ganggu. Okay, so unfortunately, our world has been rocked and shattered by the fact that one of our celebrities recently succumbed to a COVID-related illness. So, COVID in pregnancy. Dr. Mardiana, do you want to take us back to that day when your life changed?
All right, okay. As you know that I'm pregnant and I just delivered. Today is, I think, day 11. Yeah, day 11 post delivery.
Looking good.
I was vaccinated, okay, during the pregnancy. I complete my Pfizer 2 doses, okay. Because of the current variant is quite I think quite dangerous. I think
more virulent, very infectious.
And you can easily caught the infection actually.
That's right.
So I'm planning. I already planned that 1 month before my delivery that I'm not going to go to hospital. I take my annual leave, okay, because I just want to avoid contact with patients or any positive people in the hospital. So I stay home lah 1 bulan, and my husband also work from home 1 bulan. We only go out for grocery shopping lah, but usually my husband yang pergi grocery shopping. So we don't have any contact with any positive people within this 1 month. Then we need to admit to private hospital. So private hospital, I think almost all the admission now, you pergi private or pergi government, okay. They will do a swab to make sure that you are negative before you can admit to the ward. So right. I'm planning to go for delivery in private hospital. So me and my husband did a swab, and suddenly my husband become positive. Okay, and we don't have.
Was he symptomatic? Did he have any gejala? Absolutely
no
not.
Symptom. No symptom. So surprisingly, suddenly mine is negative. Husband is positive, okay, and no symptoms, because I think because my husband also partially vaccinated. He had 1 dose of AstraZeneca already. Second dose is within this month, okay. Yeah. So bila dah swab positif, then cannot lah go deliver in private hospital. So I need to go delivery at government hospital lah, Sarawak General Hospital.
Go back home, balik rumah.
Yeah, so I become PUI, and my whole family member become PUI. So as a result, my daughter pun kena swab, my family pun kena swab. I did my swab 3 kali actually, when during admission and after the operation. Okay. And the third one become positive. So
that's a bit delayed, huh?
Yeah, because I think I got it from my husband, but my husband, the CT value is quite it shows in the recovery phase already lah. Tapi bila my swab dia shows is macam baru kena lah. The third swab.
Can you explain what the CT value is?
My CT value is 17. You know that CT value, the smaller number is the CT value. It means that you are very infectious. My husband is 34. I'm 17. So it means that I'm very infectious. When I was when I did my third swab. So so end up I kena beranak di General Hospital lah, under a special team. They have in General Hospital, they have a special COVID team lah. So the doctor, the surgeon, the NS, the PIT would be in a special operation theater for COVID patient. Okay, so they did my operation in COVID theater using the PPE lah, the PAPR, the space suit. So
macam pergi bulan.
That's how, yeah. So my husband tak dapat teman I untuk delivery. So I end up Caesar in a dikerumuni oleh angkasawan. So kita tengok kiri kanan semua orang pakai PPE. So so it's not a nice experience actually. And of course, if you are COVID positive, baby will be isolated from you until you finish quarantine lah. You cannot touch your baby ya. Memang protocol, if your baby, if you are positive, you cannot touch your baby sampai habis quarantine. So my baby is not with me now.
Oh, that's so sad. Okay, so you mentioned earlier on that you were vaccinated in pregnancy, and this is something that sparked a lot of conversation. Yeah, it's very important. Do you believe that your mild infection with COVID-19 is because you were protected by your vaccination?
Yeah, actually vaccination helped me a lot, okay? So you can imagine if I'm not vaccinated and I got this infection, I try to avoid all the restrictions. I duduk rumah, I tak keluar rumah. I even pergi ambil cuti 1 month before my delivery date because I know my hospital environment is full of infectious condition. I avoid all the restrictions, but I still got it. And my husband don't know mana dia dapat. So mostly from outside lah, from grocery shopping or from pasar market there. And that virus follow us home. Okay, the virus follow my husband. Okay, and then the husband infect me lah. So actually most of the cases yang COVID positive mother, actually they got it from husband actually. Okay.
Yes.
So be careful.
I wanted to ask you, what do you think? There are a lot of pregnant mothers who think that they should avoid getting this vaccination and that stay home, duduk rumah, and orang berkelilingnya yang divaksin cukup. Do you believe that? Aek Periuk kaya?
Even my husband is considered vaccinated, pun still carry the virus. But the problem is no symptom. And you cannot see the virus, okay? No symptoms. Tapi then bila you buat swab, then suddenly positive. So actually the virus already follow you balik rumah for I think maybe few days, for weeks already. So vaccination still important actually.
Yeah, so this is a hot topic because recently, like I said, we unfortunately said goodbye to Siti Sarah. And I mean, it's one thing to feel sad, everybody feels it, but it's another thing just to rasa feeling sad aja lah. So we need to learn from this. And one of the things that really struck me and struck the nation was that Siti Sarah was not yet vaccinated. She was at 28 weeks, but she wasn't vaccinated. And we had a chat with the consultant ONG Sarawak. He mentioned that she was 28 weeks. If she wanted the vaccine, she would have gotten the vaccination. But her husband actually wrote an open letter, which has circulated on social media, saying that Siti, the deceased, tidak sempat to be vaccinated. What are your thoughts on that?
Tidak sempat. Actually, she's 28 weeks. So actually, she's entitled to get the vaccination already. I'm not sure what her comorbid that making her to become worsen so fast. Okay, but I still think that the PPV at her area should fasten all the vaccination for the pregnant women. Actually, like what we did in Sarawak, okay, what we had in Kuching now, we have a walk-in for postnatal and pregnancy women. So they no need to wait for My Sejahtera appointment, and then they just go to the PPV center and get vaccinated. For especially we prioritize pregnant women here, but I'm not sure what happened in Peninsula. But maybe there's some problem that need to be sorted out there. So I think that there's a delay for vaccination in her area.
So also, on the Sarawak General Hospital level, we know that we see high-risk pregnant mothers in the clinics, and there was a big push from all the specialists to recruit high-risk mothers for the vaccination. Do you think that also helped in improving our vaccination rate?
Yeah. I think actually the doctors that seeing the patient in the clinic also plays a big role to push for the vaccination. I even helped during my leave. I even helped few pregnant mothers to get sort of like express slot lah for vaccination, because I know they should get the vaccination as soon as possible. Okay, especially when they already passed the first trimester. So I help using any way lah, apa cara, I just slot them for vaccination. Okay, and just register them. I think it should be done to the other places also. The doctors in MPH or ONG should facilitate and make a express appointment lah for this pregnant woman. Kan.
Yeah, agree. So yes, it's actually quite difficult for us in Sarawak to find somebody who has not at least had their first dose. And that being said, it shows a great deal, and it is evident in the fact that there are 70 maternal deaths Malaysia-wide. Okay, the whole of Malaysia, there are 70 maternal deaths, but only one from Sarawak. And Sarawak is the size of the entire peninsular Malaysia. And we have less hospitals. Yeah. So I wanted to ask you, because a lot of people are asking this, like Siti Sarah, she's pregnant and she's not vaccinated. She's pregnant, she's COVID, and she's not been vaccinated. How actually do we manage such cases? Do they go home? Is there something else that we can learn from this so that the next case will have, a better outcome?
Okay. What happened to me that day when I was diagnosed positive COVID? Okay, so I was actually admitted to medical ward upstairs. Okay, medical ward. So the physician, they did some blood tests. They did X-ray to me actually. X-ray.
While you're pregnant?
And that time is after day one post seizure. Okay, post delivery. So that time they did all the checkup. I think they want to make sure that if I'm considered infectious or not, or maybe they just want to do initial assessment. So it sounds like I'm get one, okay, because I have no symptom at all, and my X-ray is okay. The assessment by doctor is important actually. Then they said if I'm okay to go for quarantine lah. Okay, quarantine. I request for home quarantine actually because my husband is also positive, and I'm post seizure. I'm not a bit comfortable to go for quarantine center, so they allow me for home quarantine lah. Okay, together with husband. But I have to monitor lah. So I kena monitor BP, pulse oximetry kena ada. Pulse oximetry. When you are doing home quarantine, make sure you check your pulse every day. So I need to give report lah every day to the team, to the person in charge. Okay, the BP, pulse rate, everything. And I was given Klexan also because of COVID. They said COVID patients who are not ambulating much need to start on Klexan, ubat cair darah. Okay. Here all the COVID patients semua kena admit ataupun assessed by doctor lah. But I'm not sure at other places. Home quarantine, how they choose for home quarantine or whatever. So that what we need to investigate lah. Okay.
I'm glad that you brought up the issue of the cute little pulse oximeter, because in the open letter that's circulating social media as well, the husband of the deceased mentioned that you must buy a pulse oximeter. I'm just wondering whether or not I mean, it's impossible, right? To monitor your blood oxygenation level without a pulse oximeter. You cannot just rely on your smartwatch, right? So
Yeah, yeah, yeah.
I'm just wondering why they only notice, and this is just me talking lah. I'm not just asking for, I'm not trying to do or pin. I'm not trying to paint anybody in a bad picture. I'm just wondering, like, why do they not have a pulse oximeter? Like, you know, that was
Usually,
a huge question that came up, you know,
yeah,
in the
happy
social media
hypoxia.
circle.
Yeah.
Okay, so I also wanted to ask you one thing about the vaccination. Now that we know that 18-year-olds and above can have it, is there, and there's recently an update on the protocol, the local protocol and guidelines for vaccination. Are we extending the vaccination? Because right now people kena tendang ba 14 to 33 weeks, kena tendang if they're before or after that. So what is the government doing to increase uptake for vaccination in pregnancy? What have they done?
Actually, if you realize, there's a updated and revised version of COVID vaccination in pregnancy on the 10th of August. Okay, it just released, okay, by the committee, the OAG committee. They put there in view of the increased incidence of COVID positive patient in pregnant women. So they already revised the guideline according to we can vaccinate to all gestation of the pregnancy. Okay, so as long you are pregnant, tak kisah you first or second or third trimester, you can get the vaccination. Okay, the best is if you can get it before third trimester lah, because usually the COVID will affect pregnant women, especially in third trimester. Like me lah, third trimester. Okay, there's a few cases in second trimester also. So if you can get earlier, okay, the vaccination and complete your vaccination, it would be better. Last time we try to avoid first trimester because we are not sure about risk of miscarriages and risk of, is there any effect to the baby development. Okay, but according to the latest guideline, because guidelines always keep on updated every month, so you cannot blame lah the committee. So the recent guideline data said there's not much effect to the baby development lah if you take vaccine. So you still can get vaccine if you are in first trimester, as long you understood about the risk. The benefit is outweigh the risk. Okay, if you want to wait after 12 minggu pun also can. Okay, if you want to take before 12 weeks also can, but it's just that sometimes miscarriage can happen before 12 weeks. It's not due to vaccine, but it can be due to
the nature of the pregnancy itself.
Yeah, the factor, your own factor, ataupun maybe there's another problem that's not related to vaccine. So if you can get it, if me lah, I suggest 12 minggu should be okay dah ambil vaccine.
Yeah. All right, there's another demographic that we are actually completely ignoring, and that demographic is the teenage and adolescent mother. Because we know we see all these teenage mothers in the ward, we see all these adolescent mothers in the ward, and they're actually at high risk because, not to say anything, but usually most of the time, and data has shown that teenage mothers are more likely to be neglected, more likely to have substance abuse, more likely to have co-infections and live in lower socioeconomic statuses. So what do you say about the latest update regarding the vaccination of teenage and adolescent mothers?
So if there are, this one for pregnant, if they are pregnant or not?
Yeah, if they are pregnant. Mothers, if they are pregnant.
Actually I baru saja dapat WhatsApp. If teenage pregnancy, 16 years old and pregnant, how there's one MO from NCH just messaged me. I said the benefit is still outweigh the risk. Okay, yes, I will still offer vaccination because her risk factor is pregnancy. Okay, you know that pregnancy is easy to get infected by current COVID variant, which is more infectious. but you have to explain to the patient. The vaccine so far there's no data lah for those less than 18 years old. Okay, I think if they said if you give like macam Pfizer, if you give less than 8 years old, the risk of apa tu infection of the heart, I think pericarditis. I think.
Yes, there's a small
myocarditis. Risk of myocarditis. That's why our government have not started vaccination for less than 18 years old because they just want to make sure there's risk of myocarditis is low or not. So in this case, if teenage pregnancy and pregnant, I will still offer, okay, because when you are pregnant, it does not matter you are teenage pregnancy ka, advanced pregnancy ka, you umur 48 ka, it will still affect you. Once you get pregnant, it's a ticket for you to get COVID infection already. Walaupun you duduk rumah 24 hours, you still can get. So you better, I still said, ambil saja vaksin.
Yeah, betul. And also the data shows that the myocarditis is more prevalent among the boys than the girls. And boys don't get pregnant, so the adolescent girls, they get pregnant. Ambil vaccine lah. Yeah. Okay.
Still good. Ambil saja.
Ambil saja. Alright. Okay, so tomorrow your husband potong gelang. Any good news about that?
Okay, the good thing is if you are COVID positive, you already have the antibody kan. So selalunya kalau you dah positif COVID, so for 3 bulan, for 3 months, you will not you tidak akan menjangkiti orang lain, and you don't become the carrier for the COVID to other people. And
you cannot get infected also.
Yeah, I will become kebal lah for 3 bulan. For 3 months.
Jolly katak lah.
So maybe in December, but then I become normal people lah.
I see. So that's, is there anything else you would like to add with regards to this? Oh, breastfeeding. Yes, breastfeeding in COVID positive mothers. Would you like to share your experiences on the postnatal ward and your own experience and what the peds tell us?
Okay. For breastfeeding, okay. Of course, you know that breastfeeding is better compared to formula milk lah.
Your baby had hypoglycemia, right? So there was a...
my baby is having hypoglycemia because of I'm diabetic, okay. So I'm sending my breast milk every day to hospital, to the pediatrics unit, because my baby is with them for until I finish my quarantine. Okay, I'm very grateful that our pediatrician is very pro breastfeeding. Okay, so although I'm a COVID positive mother, okay, they allow me to send EBM to hospital on daily basis, okay, but of course they will take some precaution lah, okay. They will make sure they wipe first my EBM, sanitize my EBM first before they can feed my baby. Otherwise, I think it should not, COVID positive is not a contraindication for breastfeeding, okay. So you still can send your EBM every day. Just need to inform the staff that you are COVID positive lah, okay, so that they can sanitize your cooler box or your EBM first before they feed your baby, okay.
And studies have shown that there is no virus, right? There's no virus transmitted through your breast milk. The infectivity is low, and furthermore, you are actually giving your COVID antibodies to your baby, right?
I have a natural COVID antibodies already.
Extra variant, extra strain. Pfizer belum ada lagi.
Yeah. not only Pfizer punya antibody, I also give the natural COVID positive antibody to my baby. So yeah, you should continue breastfeeding. Okay.
All right. Okay, so that's all we have for today. Number one, get vaccinated. Number two, if you're home, get a pulse oximeter. Number three, once you have delivered, try your very best to breastfeed. Okay, there are a lot of avenues for you to get help for breastfeeding. And join us again next time if we ever have another Aek Periuk with Dr. Mardiana.